We know how hard this is. People are afraid, and we wish everyone well. And as Chairman Plancarte said, the reason that we're here today is because we want to take protective and preemptive action to keep our community safe, as opposed to reacting when we think community transmission is going to come. At this time, there is still no evidence of community transmission here in Imperial. We've only had 2 confirmed cases. We have other tests that are pending, but to date, everyone so far that has been tested has been negative. However, I'm sure most of you are aware that many of my fellow health officers around the state have chosen to take action to try to protect the public. Many of them chose to do so because there was significant community spread going on around them. I have given my recommendations to the Board of Supervisors that rather than wait for community spread to occur, that we should take action to prevent community spread. Because of that, I have developed a health officer order, which has been approved, and that will take effect midnight on March the 20th. So effective midnight, March 20th, and continue until 11:59 p.m. on March 31st, the following will be in effect in the County of Imperial. Number 1, all public and private gatherings as defined in Section 17 below are prohibited. All gatherings of any size are strongly discouraged. Number 2, all bars, adult entertainment establishments, and other business establishments that serve alcohol and do not serve food shall close. Number 3, all restaurants and other business establishments that serve food shall close all on-site dining. All food served shall be via delivery, drive-through, or pickup on site. Social distancing shall be required when picking up food on site. Number 4, all businesses shall enact social distancing, increase sanitation standards, and environmental cleaning in accordance with guidelines issued by the California Department of Public Health and the Centers for Disease Control and Prevention, and shall make every effort to implement telecommuting options for its workforce. All businesses shall suspend any policy or procedure that requires an employee to obtain a doctor's verification or approval before utilizing sick leave or other forms of leave. Number 5, it is strongly recommended that all persons who are 65 years of age or older, who have chronic illness or underlying condition, or have a compromised immune system, self-quarantine themselves at home. Number 6, non-essential personnel as defined in Section 17 are prohibited from entry into any hospital or long-term care facility. Number 7, hospitals and healthcare providers shall take measures to preserve resources, including delaying non-emergent or elective surgeries or procedures when feasible. Number 8, all persons arriving in the county from locations found on the Centers for Disease Control and Prevention Warning Level 3 Travel Advisory, as may be amended, shall be subject to a 14-day home quarantine and self-monitoring for fever and respiratory symptoms. Number 9, it is strongly recommended for any person exhibiting mild to moderate symptoms of COVID-19 to self-isolate themselves in their place of residence unless seeking medical treatment. Number 10, this order is issued as a result of the World Health Organization's declaration of a worldwide pandemic of COVID-19, also known as the 2019 novel coronavirus, which as the date of this order has infected at least 179,000 individuals worldwide in 155 different countries. It is implicated in over 7,000 worldwide deaths. Number 11, this order is based on the increasing transmission of COVID-19 in California and the significant risk of widespread introduction and transmission of COVID-19 into the county. Number 12, this order will reduce the likelihood that many individuals will be exposed to COVID-19 and will assist in preventing the spread of COVID-19 in the county. By assisting in the prevention of spread of COVID-19, this order will help to preserve critical and limited healthcare capacity in the county. Number 13, this order is issued in accordance with and incorporates by reference the declaration of local health emergency issued by the health officer